Thank you, you and Ranking Member and witnesses. Thank you for joining us now this afternoon. First, Dr. Walensky, I'm interested in learning what the administration's plan may be in regard to vaccination mandate. Just days ago, you signed off on the emergency use authorization for pediatric COVID-19 vaccine. The issue of mandates is roiling across the country, and while there are many parents who are interested and willing to get their young children vaccinated, there are also other parents who still question the pediatric use emergency use authorization and are concerned about a potential federal vaccine mandate. I share the concern about federal vaccine mandate. I urge the CDC and the administration against implementing a vaccine mandate for students. Forcing parents to vaccinate their children as a requirement to attend public school would be, without a doubt, a federal overreach. Federal government mandates for children to attend school, that would represent an extreme departure from our educational system's historic, long-standing reliance upon local and state control. And in my view, the decision to vaccinate a child should be left to the parent and their trusted physician. It's a private relationship the federal government should not be inserting itself into with a mandate. Perhaps all that commentary is unnecessary, and you can just assure me that that is not what is the next step in mandates from the Biden administration. And if just you can only answer, maybe perhaps you can't answer what the Biden administration is going to do, but what is your thoughts and what would your recommendation be?
Thank you, Senator Moran. I am delighted that this week we were able to strongly recommend that 28 million children receive a COVID-19 vaccine to prevent infection, to prevent severe disease, long COVID, multi-system inflammatory syndrome, as well as death in the children that we have seen between the ages of 5 and 11. Those recommendations are strong. They are after endorsement of the FDA's emergency use authorization. Vaccine requirements are left for schools are left to the local jurisdiction, and so we will leave those to the local jurisdiction to make those decisions.
So Kansas parents who may have concerns about whether or not their children will be able to attend school, that will not be a decision that's made without a vaccine. That's not a decision that will be made by the CDC or the Biden administration, but remain a local decision to be made by a local board of education.
I will always encourage that parent to get their child vaccinated and speak to them about the information and communication and education that they need in order to get their children vaccinated. Right now, at this moment, those decisions are made at the jurisdictional level, as they are for vaccination of other vaccine-preventable diseases among children.
I felt better when you said, before you said right now, and that just causes me to, again, ask, is there any intention to change that long-standing practice?
Not to my knowledge.
Thank you. Let me call on Ms. O'Connell. Ms. O'Connell, I've been a supporter and seen the value. A long time ago as a House member, I offered a Moran 10-point plan on saving health care costs, of reducing health care costs. One of those components is the value of community health centers. And I'd like to give you the opportunity to tell me what it is that can be done, should be done, to continue to include those community health centers who have played an integral part in combating COVID-19, that they're capable, more capable, and prepared should there be another pandemic.
Well, Senator Moran, thank you. This is one of the things that you and I have in common. Strong supporter of our federally qualified community health centers, our rural health centers, and the program that HRSA runs to support both. We've seen the FQHCs play a significant role in distributing vaccine. We're also running a pilot program right now, which allows them to distribute free at-home rapid tests to families, and I think that's another important way in which they can contribute to this response. We're hoping to scale that up by Thanksgiving. Right now it's in 8 states. We've also been able, through the FQHCs and rural health centers, distribute masks to families that might need them, high-quality masks, and of course they continue to provide clinical care to families that seek their care there. So continue to see them play a significant role, and we're always looking for opportunities to increase the impact they can have in this pandemic.
I thank you for that answer, and I want my community health centers to know how valuable they are, not just in a time of a pandemic, but throughout the daily life of lots of Americans. I just visited one in Kansas City, Kansas last week. Again, reminded that they serve a very valuable purpose and a way for those who might not otherwise access the opportunity to have a consultation with a healthcare provider to be able to do so and to make a decision about how to care for themselves and their families. Thank you very much. Thank you, Chairman.
Thank you. Senator Burr, any closing remarks?
Thank you, Madam Chairman. To all four of our witnesses today, thank you for the job you do, and more importantly, would you go back